Morning. I have a question about the patients. I'd like to hear in more detail who the patients are that come to see you, whether it's the social, economical, also their ages, also follow-up treatment. If they live far away, how do they get back and forth? Anything you can tell us about the patients?
This hospital is in a way away from Vellore city, which is close to many rural areas and hilly areas. So many tribes and village peoples can also come here and get benefited. People are coming and getting benefited. In case if they have to go and wait in a government hospital, they have to wait for a longer period and the crowd is more. So relatively the crowd is less here, so that they can come and see their doctor, and more than that they are guided properly in this hospital what to do next, because which is very important for a patient, so they should know what to do next. So that is excellently given in this hospital.
What age groups would come here? Like what types of diseases do you see the most per age group?
Age group. Here, age group wise, if you take, we have all kinds of age patients are coming from infant to adults. But more importantly, we have patients with common ailments like abdominal pain related to renal, kidney diseases and bowel diseases. And apart from that, we also have many trauma patients nearby, road traffic accidents, any accidents happens, they come here. Here we have 24 hours facilities to give them the necessary treatment. We have a good casualty to take care of them, and we have a good ortho department. Everything, mainly road traffic accident and trauma care is excellent here.
And are there any restrictions in terms of admission for people of different cultures or different religions or different anything? Or is it open to anyone?
There is no restriction for anyone. The restriction will be only when we have no bed in the hospital. That is the only time we can refuse the admission of a patient. But that too, if the patient is in real emergency, we have to definitely treat the patient. So not that there is no restriction like for anyone according to socio-economical. There is no restriction at all. People from any caste, any religion can come here, get treated and get benefited.
And are there groups such as the military or the insurance companies or anything that help cover the costs?
Definitely. We have a panel of insurance which covers the patients, and we have the ECHS which supports the military people who have retired from the military, aged persons. So they have to pay a minimal charge for get this, and will get the same benefit as the other patients who are paying the full amount. So the insurance covers the loss of the hospital bills. So we are treating the ETCM patients and other military related patients who are retired from the military, who have been getting treatments in some various places. For example, a military person will be getting a treatment in northern India, like in Kashmir. Once he is posted here, he can continue his treatment with the same benefits what have been given in the other places.
And what about patients from other countries? I understand patients from Nepal and Bangladesh are searching to come here, which is a very long distance. Why would they travel so far to come to this hospital?
See, this hospital addresses the patient's complaints and gives a right treatment. So they prefer that they are getting the best treatment here, and they, through the word of mouth, they spread the news to the other relatives and friends. So whenever they find any difficulty in their nation, their place, they come here, get treatment, get benefited, go and tell that we came to Narayani Hospital, got benefited, and through that other patients comes. So that is how we are not propagating, we are not canvassing anyone. The patient themselves bring the other patient here.
And what about doctors? What types of doctors choose to work here?
So we have all specialty doctors here, and most of the doctors stay here in this hospital for a longer period, are service oriented doctors who can, with respective of the time, they can be here at any time, apart from the duty times. If there is any emergency, they have been coming and serving the patient. Their need is there. For example, a surgery, it has to be done on the patient emergency. The surgeon who's finished his duty and gone, he can be called and he will fulfill the need of the patient and he'll do the surgery. Irrespective whether he is on duty or off duty, whenever he is on call, he'll definitely attend and he'll do it.
I understand that you're now doing transplants.
Yes, we have recently started the renal transplant unit, and we are yet to flourish in that unit, but we have recently started. So we are just trying to do cases. We are guarded in selecting the cases because we don't want any mishappenings happening. So we just want to select the patients, select the renal transplant kidney properly, give the better treatment to the recipient of the kidneys. So we are very guarded in our things, so that since we developed recently in this transplant specialty, we wanted to be very guarded in doing it.
And what do you see in the next few years in terms of transplants? Do you have any idea of the future plans for transplants?
Yeah, transplant is going to be the future. Instead of treating the diseased organ, it is better to remove that, and transplant will be the future. For not only for the kidney, there are other transplants like liver transplant, lung transplant, and other transplants are happening. So hope that we'll also specialize and do the more transplants in the future, and more people who are involved in transplant also comes and joins in this hospital.
Approximately how many doctors work here at this present time?
I'm not very sure, but I think we are around 350 to 400 doctors.
That's it. Thank you.